and thank you so much to Wemos for the invitation to be presenting here the work and on health and care workforce that we are doing in WHO Europe and presenting a little bit of the situation. Last year, we launched the regional report Health and Care Workforce in Europe, Time to Act. The report described the main challenges on health and care workforce in the region, described some good practices, and presented data of 53 countries in the region on health workforce. And in addition, it presented 10 action points for the way forward on how to improve and strengthen the health and care workforce. So some of the findings, what we see in the report is that from 2010 to 2020, the availability of doctors has increased by 14% in the 53 countries in the region, and by 8% for nurses from 2010 to 2020. And at the same time, the production of doctors have increased 37%, and the production of nurses has increased by 26%. So basically, what we see is that we have more doctors and nurses than ever in the WHO European region, and specifically in the EU countries. But at the same time, we are seeing how the doctors especially are aging, and we have a very old doctors workforce. So we see, like, in 11 countries in the European Union, at least 40% of the doctors are over 55 years of age. That means that in 10 years, at least 40% of the doctors will go on retirement in these 11 countries. So this really poses a challenge, and that's why we were talking about time to act, or even a ticking time bomb, which was taken by the Guardian article and referenced in our article. Then we also need, in the report also came out data on sex distribution. We see how half of the doctors in the region are already women and increasing. And we know that the nurses are mainly women, 89%, and midwives, 98%. And in total, 2/3 of the health workforce are women. So we really need to take into account the gender dimension when developing policies. And now we are working as WHO in developing a framework for action that will be presented in the regional committee in October in Kazakhstan, in Astana. And that framework for action really puts the health and care workers at the center of the framework, putting their needs at the center. And the first thing we need to do is improving retention of health workers, so we are able to retain those health workers, because despite having high number of health workers, we know that they are aging, we know we have issues of migration, we know that we have issues of burnout and health workers leaving the profession, attrition. So we really need to improve the working conditions to retain, to keep those health workers in the system. And that's why it's so important not just having a fair remuneration, but having flexible working arrangements to find a work-life balance, in having taking care of the mental health and well-being of the health workforce. All these issues are really becoming important. Another important issue that you are discussing is improving the recruitment and retention of health workers in rural area, which is a major priority and is one of the key actions in our framework. And also we need to look at, as I was saying, improving the health and well-being of the health workforce, and that came out very strongly after the COVID pandemic. And also migration, we see how migration is increasing globally, and some EU countries are really attracting a lot of health workers from different systems into the European region. And these dynamics, I think that those are dynamics that we need to look at, and look at the triple win, and taking into account the WHO code of practice, the triple win between the source countries, the destination countries, and the individuals. Anyway, in terms of way forward, 3 weeks ago, the WHO regional office organized a regional meeting with 270 participants from 50 out of the 53 member states in the region, and we signed the Bucharest Declaration on Health and Care Workforce, really setting up the principles to strengthen health and care workforce in the region. And then, as I said before, we will move into a resolution in the regional committee in October. Thank you so much. And as a summary, I would say that health and care workers are at the heart of the system, are the beating heart of the system. And if we want to improve access and quality of health services that are responding to changing needs of the population, taking care and caring those who care are is critically important. Thank you so much, and looking forward to keep discussing in the future. Thank you so much.